Hi, I'm Melissa Ewing from West Coast Therapy, and today we're going to do some training on cardiac. Some of the major things you're going to see with cardiac is someone who is having a heart attack, congestive heart failure. Having a heart attack, the definition is when there is a death of the heart muscle due to loss of blood supply. Some signs and symptoms of a heart attack are pale, sweating, shortness of breath, and chest pain. There is a referred pain that many people have, and they feel that through their jaw, down their shoulder, their arm, and into their hand. That is different pains that you can feel when you're having a heart attack separately than just the normal chest pain or the elephant sitting on your chest. That is a severe pain that people get, and that's a very common, but it's not always the way that people have a heart attack. Women can present differently than men. They can get severe abdominal pain, and you think it's something else, but that's how women can present sometimes when they're having a heart attack. So it's important just to look at the overall picture of the patient. Don't ever second guess yourself. If you think somebody's having a heart attack, go ahead and do further research into it just to make sure that that's not what's going on. Another symptom is nausea and vomiting, along with pain in the arm or back pain, shoulder pain. If the pain can be made better, if they throw up, if they take Tylenol, anything like that, and it improves, it's not cardiac. It's muscular, skeletal, or something else going on. It's very common to see a heart attack after eating a greasy meal for these older residents. So if after a meal they start having some strong symptoms, that's definitely could be something to look at. You need to know your resident's history when it comes to cardiac. If they have cardiac history, make sure they have nitro. Try that first and see if that relieves the pain. A lot of them will keep nitro with them when they have cardiac history. Once you've identified that it's a heart attack, call 911, then try to relax and get prepared to do CPR. And those are some of the common things that you need to do as a caretaker for your resident in an emergency. The next diagnosis is congestive heart failure. The definition of congestive heart failure is weakness of the heart that leads to buildup of fluid in the lungs surrounding the body tissue. When you have right-sided congestive heart failure, the atrium can't keep up, usually presents with edema in the lower extremities. When you have left-sided congestive heart failure, fluid in the lungs, shortness of breath, fatigues very easily, you will hear a very wet cough. When they cough, you will hear it almost sound like they're drowning. That is part of the left side. Things you can do to help your resident who has a history of congestive heart failure. Avoid salt, elevating legs, foot pumps, compression wraps by your occupational therapist or nursing who are trained in wrapping the legs, because that's a very specialized field. Keeping these residents active is very important. Sedentary, them sitting in the rooms all the time, not getting out and moving around, can lead for them to go into congestive heart failure also. Encouraging them to engage and participate in any activities that you're having in the facility is a great idea and a great help for them. If you see a decline, they're not going to activities, they're not eating their meals, they're not coming out of their rooms, it's another red flag to look at for congestive heart failure. Next diagnosis is hypertension. The definition of hypertension is repeatedly having elevated blood pressure. The standard is anything over 140 over 90 repeatedly. There's times that they're going to have high blood pressure and it's not going to be everyday occurrence. It's usually from a stress or something's going on within their body. Signs and symptoms of hypertension is headaches, dizziness, lightheadedness, unsteady balance. Sometimes there's no symptoms, and that's why they call hypertension the silent killer, is people don't realize that the blood pressure is high and it goes on for a long time, and that causes damage to different organs. It can cause thickening in the heart, kidney failure, brain damage, and can eventually lead to stroke, heart attack, and kidney function impairment. These are some things in cardiac that you want to watch out for that are common in this age for these residents.